Hello, it's Paula again. As you can see, I'm starting to get my voice back a little bit better. It's definitely not all the way back. It's May 8th, so I'm about 3 weeks and a day post-op. The only real issues I've been having lately is I feel really good when I take my medication. So then I try and not take it on my next dose, and I start feeling really crappy, irritated. It just hurts. So my advice is take your medication that they're giving you. Right now I'm still on Percocets, the 10-3-25s, and then I take a Tylenol, an extra Tylenol on top of that. I'm also on diazepam, which is Valium. So that combination of medication, if you can get from your doctor, is just so awesome. I've barely had any pain if I kept up on the medication. Another thing I'd like to suggest, because of that type of medication and how strong those are, there's no way to remember what the last time that you took your medication. I'm supposed to take the Percocets every 4 to 6 hours and the Valiums every 6 hours. So I just make it a point to take my Valium and the Percocets at the same time. The doctors also got me on another medication called gabapentin, and it's 300 milligrams, and it's only at night. And as far as I'm understanding, it's for nerve pain. As of right now, I am looking at my surgery as half success. I've had shoulder surgery. There's nerve issues, numbness in my fingers, elbow, just a lot of issues going on up there. I don't know if we waited too long for the next surgery to fix my shoulder, but as of right now, I'm thinking I have nerve damage completely in my shoulder right here. With the scar, let me get a little bit closer for you, or the incision, starts from about right here, right where that dark spot is, and then I have a mole right here, so it ends about right there. It did not itch whatsoever when it was healing. I had absolutely no stitches, no staples. I just had that medical, I don't know what they call it, the suture tape or whatever, over. When they gave me my soft brace, which I absolutely hate, I'd rather wear the hard brace. I just feel like I'm constantly being choked, because it's supposed to fit snug. When you turn your neck, it moves, you go up, it just feels like I'm constantly being choked. Almost like a claustrophobic type feeling, and I'm not claustrophobic whatsoever. But the healing right here now, again, just over 3 weeks post-op, it's starting to itch on the inside of the incision, so that's making it kind of difficult. I just sit here and I'll rub it just like this, and it'll usually calm down the itching on the inside. I put hardly any pressure, just a very light rub. I haven't put any ointment on it. What else? I see a lot of other people going through the same thing that I'm going through right now. Under here is still numb from surgery, and I'm assuming lidocaine. I'm not quite sure, but it's still numb, almost like nerve damage right underneath here. They say that goes away, or normally goes away, after 6 weeks or so. So we will find out on that one. Next appointment will probably be my next update, since everything's going so well. I'm still not supposed to be bending over. I'm supposed to be wearing my neck brace now. I just kind of woke up from a nap, so I took it off to air it out. It's been in the high 80s to high 90s here in, excuse me, in Carson City, in the last week. So the sweat making it itch even more around in this area. And yes, it does itch even though you can barely have any feeling. Like, I could probably go get a piercing if I wanted to right here and it wouldn't hurt. I wouldn't feel it. Again, the chest cold afterwards was completely horrible. I have never had a chest cold that bad. I've never had laryngitis. I am now probably 2 weeks on the laryngitis. There were, no, I would say about 2.5 weeks now. For the first 2 weeks, from the chest cold, which started 2 weeks after surgery, I could not talk whatsoever. I had to throw things at my family members to get their attention because they just couldn't hear me. Or I would go, hiss, psst, to try and get their attention. I know that sounds funny, but yeah, it right now is mainly just, it just feels like it itches, you know, which I know that means it's healing on the inside. The scar, it's pretty thick in some places, and other places it's not. Not quite sure how it's gonna fully look after it's completely healed. Still trying to find out when I can go back to work, or go back for training. I won't be able to go back to my regular job, more than likely. I do security work. I've done it for 15 years. It's your normal security outside. You take people down that are drunk and stupid. And at this point, the way my body is, there's no way I could do that. I could do it if I had to, but it would impact my body pretty bad. Paperwork, that's what we've been trying, light duty, for the past 2 years. The repetitive motion in my arm it just doesn't want to take it. So the typing, the paperwork, I have no strength in my right side or my left side, really. I have more in my left than I do my right. I can't strengthen, can't do really anything right now. I want to go back to work. 2 years of no work is driving me insane. You know, plus workers' comp, you get 2/3 of your paycheck, so you're not even getting all your paycheck. And my cats decided when I have a little spat behind me right now. So if you have any questions, don't hesitate to, you know, leave them in the comments. I'll get back to you as soon as I see them. If you are going in for this surgery, I highly recommend it. I had a lot of anxiety. I was very scared, only because they were right next to my artery. It's very scary, but in the long run, it is worth it. My doctor, excellent doctor, best in Carson City, orthopedic. I don't know if I'm allowed to say his name, but Dr. Jones. I also had an ENT doctor that worked in the surgery with him due to having to do with the throat. So yes, if you have any questions, please feel free to ask. I will get back to you. Everybody have a wonderful evening. Bye.